Sure. I'm Dr. Caitlin Bundock. I am an assistant professor in the Department of Special Education and Rehabilitation Counseling at Utah State University. Um, and some of the main things that I study are mathematics education and interventions for students with high incidence or mild moderate disabilities, which would include ADHD. So, yeah, largely I found through working with them that there was a lack of research in that area. I would try and find different strategies and ways to support the students, especially with accessing higher level math, and found that there just wasn't a whole lot out there. So that really is what drove me to want to go into higher education so that I could do research and find some of those strategies, and then also be able to train future teachers to implement the strategies well with their own students. So it is classified if you look at the different organizations that that do research and things on it. So one of those would be the National Institutes of Health and the National Institutes of Mental Health as a neurodevelopmental disability that impacts people primarily in terms of impulsivity, hyperactivity, and inattention are the three main symptoms or characteristics that are looked at. In order for ADHD to actually be considered, or for someone to be considered to have ADHD, those three different symptoms, at least one of those three different symptoms, need to impact someone's daily living to a significant degree in terms of whether it's a social aspect, academic, for adults like work. But everybody experiences at least some degree of each of those different symptoms. And really, for it to be considered a disability, it would be looking at more of the impact in terms of that daily life. Okay. Yeah, personally, I like to look at it as I know this is jumping ahead to some of the other questions that you got, but more of a neurodiversity. So there's definite strengths that ADHD brings to people as well. And I think it's more looking at that whoever it is that you're working with as a whole person. So you can see what are the areas that they've got strengths in and what are the areas that they have some difficulties in, and finding ways to use their own strengths to help overcome those areas of difficulty in terms of how you look at intervening and supporting them in whatever environment it is that the ADHD is impacting them and their performance.
So you're saying that a person with ADHD doesn't necessarily have to have, all the symptoms,
mm-hmm.
and all those symptoms don't necessarily have to affect the person's life in a negative manner.
Right. Mm-hmm.
Okay.
Yeah, exactly. And there's technically three different types is oftentimes how, mental health professionals will look at ADHD. So you can have an inattention type where that's the main symptom, hyperactivity type where that's the main symptom, or a combination where you might experience both inattention and hyperactivity to some degree. So it's a very common neurodivergence to experience. So I know it's very common for college students that I've worked with, probably about one in every group, every class that I've got, I would anticipate just based on prevalence rates. And then also when I was working and teaching in high schools, I would say probably maybe 25% upwards of the students that I worked with, which were all students with disabilities, okay. Would have ADHD. It's probably like a high estimate, but probably somewhere between like 10 to 25%.
So just for those, I guess, all-encompassing, how
mm-hmm.
much of the population in your studies have you found that has ADHD? Like what percentage of the population?
Yeah. So I know if you're looking at school-age population, it depends on the school also, but like 10 to 15% have more mild, moderate, or high incidence disabilities. So probably within that, I would estimate like maybe 5%. I think that a percentage that I saw on the National Institutes of Mental Health website for adults was about 2.5% of adults have ADHD. So it means that, it sounds like a small percentage, but when you're looking at kind of neurodiversity broadly, that is a pretty prevalent one. Okay. For college, the data gets a little bit trickier to track, okay. Just because of how services are delivered in colleges. People have to opt into services and kind of pursue them, seek them out themselves, right. Versus in public schools, K through 12 education, there's an eligibility and evaluation process where parents can kind of raise concerns, teachers can raise concerns, so
Right.
it's a little bit easier to see who might need that support.
It's more of some people wonder if the reason we see such a high prevalence of ADHD diagnoses in, let's say, younger children, like in elementary school, and higher than that, is because and this study that I was reading was specifically in relation to young boys, that their symptoms were more related to simply growing up and the normal behavioral kind of patterns that young boys have at that age. And their claim was that it was misdiagnosed and that people make that diagnosis prematurely,
right?
And that's why we see such a high spike in ADHD counting. Would you agree with that? Or
yeah, it can happen for sure. I know, within special education, one topic that I've looked at a little bit is over or under identification of various disabilities. And so, yes, I think that there are some cases where it's over identified, especially for young boys in particular. On the other side as well, oftentimes females are missed with it because if they're not really engaging in the hyperactivity component, but the inattention component, girls are often socialized to sit very politely, not be disruptive. And so a lot of times girls will actually go underdiagnosed too. So
really?
One other thing to recognize too is just when you're thinking about disability broadly, is that it is a socially and contextually bound concept. So something that can be considered disabling in one context isn't disabling in another. And if we look at ADHD in particular, one of the strengths of it is the ability for people to hyper-focus. So people with ADHD can become really immersed within a task and enter more of like a flow state and be able to kind of like have superhuman abilities almost to get something done and get it done really, really well and really, really efficiently, especially things that involve like working across and thinking and keeping track of multiple things at a time. So in a context that requires that kind of thing, they can excel compared to people who are not neurodivergent, who are neurotypical. But in a context of you just have to sit and write a paper, it can be disabling. So it really is just based on the context that you're in for how it can, either help you excel or inhibit performance.
There is a number of records where people that have been very successful exhibited symptoms, and people believe that they had ADHD. People like Albert Einstein, Bill Gates, Benjamin Franklin, Nikola Tesla, Leonardo da Vinci, and Alexander Graham Bell. Have you delved into any of the research that shows whether or not that has any correlation, whether successful people do have they're more likely to have ADHD, or is that?
And so Temple Grandin is one like famous person that designed just different ways of actually interacting with agriculture and livestock based on, she has I don't know if she has ADHD, but she has autism, and was able to come up with just some really innovative ways because of thinking about things differently. And I think that that's something that is often left untapped because if we focus too much on what people can't do, then we don't see their unique ways of actually approaching problems and approaching, topics.
ADHD, which is under the umbrella of developmental disabilities, is a unique one because you can qualify for things like IEP, Individualized Education Plans, in the K through 12 system, which gives you additional supports to make education more accessible. And they do standardized tests. It's like multiple choice questions basically, and then based on their answers, it kind of determines where their quote unquote symptomology lands. Prior to DSM-4R, it used to be ADD, attention deficit disorder, and I think attention or ADHD with specifiers. So now they've collapsed all of those into one diagnosis called attention deficit hyperactive disorder, ADHD, and then they give you specific specifiers. There's actually, I'll send you a new study too that I was reading last night as I was thinking of this, where they've mapped out the symptoms of all disorders in the DSM, and there's so much overlap between all of these different disorders that from an accuracy standpoint of like a clinician working in a clinic trying to diagnose things, it's really hard to be accurate across clinics and across providers because all the symptomology seems to map. With depression being like the one that maps on to I think like 233 different disorders. It's not like a broken bone where you throw it up and under an x-ray you see it. What we do with mental health concerns is you see behaviors and behaviors within context, and based on that we throw labels at it because that's how the medical model works. And in my opinion, we should be focusing more on how do we help improve people's quality of life, which I think was some of what you said in your introduction, or at least alluded to it, is like how do we support folks that are experiencing this type of experience.
Right. And there's some debate on that, whether you should medicate them, things, use of like Adderall or...
Yeah, Adderall, Ritalin, stimulant. Basically, they have stimulant, non-stimulant options.
Or, a lot of people are talking about whether you can use, there's been studies that show that, regular exercise are getting a lot of sleep.
Yeah, with kiddos actually. So like what a researcher that we had here, I forget his name, he was a grad student. I was a grad student here, but he studied the observation of green spaces versus Ritalin as a treatment for ADHD in kiddos. And just by exposing kiddos to green space, he was seeing similar effects to a normal dosage of Ritalin for a kiddo. What is your actual target of treatment, or what's your goal? Is it trying to get rid of having that issue? I don't think you can, because it's part of the normal human lived experience. These are just differences in people's human experience, and we're trying to help them learn skills to live well with their experience. Whereas the medical model, which says, let me give you medication, this will then treat it and stop that from occurring so you have better options. I don't really have a personal judgment. I think there are benefits, pros and cons to each. So my job as a therapist is just to inform people of options and then help them explore that. Intellectual disability. So what I'm trying to say is like what you were saying is, hey, well, we all have these symptoms. Absolutely. But are they causing everyone clinically significant distress to where it's getting in the way of the things they want to do in their family or social relationships, in their work environment or educationally? That's what we're trying to do, is use these as a tool to get services.
Right. So if you can kind of group in a way people that have similar symptoms and it's causing them harm or grief in their day-to-day life, if we treat it as, a disorder, we have that classification, then these people that are having struggles, they're able to get the resources and the tools that are going to help them to lead with.
I will caveat what you just explained as very much how I think about the world, but there are other people that think differently than me within the clinical space.
Okay.
So like to me, I view diagnostics as very much a tool to qualify people for services. So if you think, how does someone get a service? Usually it's insurance, right? And to get an insurance to cover a service, what do you have to have? A diagnostic code, an ICD-10 code is what they're called. And to have that, you have to go through a diagnostic procedure. So that's how you qualify for even just getting the supports you need to, be able to live and participate in community if you have any type of varying issue. Like, so for instance, I've gone through lots of treatment before, and to have treatment covered, I had to have a diagnosis. Did I go through any full screening diagnostic procedures? I don't remember as a kid. So did the therapist likely just throw some type of diagnostic label on that and didn't tell me about it and just kept supporting me? Yeah. And then he was treating something but didn't tell me about it, because actually what we know about a lot of what we're seeing with diagnostic labels is when we actually tell someone they have something, the stress increases.
That's super interesting, because that was a question I was going to ask in a different interview, but there's an effect called Pygmalion?
I've never heard of it.
I'll have to...
You can send it to me. You can teach me. I haven't ever heard of it.
But basically the idea is that if you become what you believe you are.
Oh, yeah.
So like if you think that...
Creates a role in the mind.
Right.
Then the mind
and I've experienced this with my ADHD, is that, or whatever level of ADHD I may have, is that if I focus on it too much, or if I think, I'm like, there's something inherently wrong with me, or different or not typical about me, then I almost use it as an excuse, and I get down and I'm not able to function as well as if I just shut it out of my mind and if I just went on with my life. But I learned to work with the barriers, the obstacles that I have with helping me focus and help me to be productive, and I'm able to do well. But if I focus on it too much, then becomes harder. Could you give like maybe 4 or 5 things that you usually tell people with ADHD or that are exhibiting those
That I tell
symptoms?
people?
Yeah, or that you like tell them to help with those symptoms or to help better manage
Yeah,
them.
yeah. Like my kid is going to school here this next year. She's going to struggle because she is used to really hands-on engaged learning, one-on-one attention because she's an only child, and she's going to go into a bigger classroom where you're sitting all day. And so we've already started trying to help her learn some self-regulation skills. So when you're starting to feel annoyed AF about what the teacher's making you sit there, what can you do internally to start regulating some of those uncomfortable sensations? That's called present moment awareness skills, mindfulness, right? Everyone's heard of that. It's useful, and what that also helps folks with ADHD do is show them that they can actually shift their attention. It's a bigger effort. A lot of people with ADHD that have explained it to me is like they feel like it's a monumental lift, and it is. So it's like giving them support, and they're able to notice like, wow, if I focus on my right foot and then focus on my left foot, I can actually shift my attention to focusing on those. So a lot of my folks with ADHD have super big ideas and are always wanting to do a lot of things all at once. And they're really meaningful ideas and they have a lot of talents to accomplish them. And what happens is that then all of a sudden Hoover Dam opens and all the water's hitting us at once and then none of them get done. And then another one is that because ADHD kind of shifts your attention and people do tend to get, I think, hurt in interpersonal relationships because ADHD has some unique characteristics to it in interpersonal relationships. That one that comes up is like abandonment sensitivity, I think, as a lot of folks with ADHD will talk about, is they'll feel like they're rejected often because of maybe their inability to pay attention where they want it to in a relationship, which then can make a pattern of like your partner's talking to you and you're not paying attention because you're really focused on something else, and then your partner's feeling unheard, and so then you get rejected but you didn't even know it, that you weren't paying attention. So what the present moment awareness skills, the attention, but then it's how do you deal with the internal cues that come up as a result of these unique attentional issues that you might experience. So for instance, like my cousin has ADHD too, so he has autism and ADHD, and one of the things that I've noticed with him is he gets hyper focused on something with school and then he misses the 10 other assignments. And in missing that, it causes him a lot of anxiety and guilt, stress, all those types of things. So then we have a spillover, so where then it compounds his attention issues. So if you can teach folks how to regulate other emotions or internal experiences that come up as a part of your uniqueness, you're able to continue persisting in a way that it doesn't get in your way of the life you want to live. Yeah. So I think that's one way in some of the folks I've seen in college students. I think what's really hard about college is like, if you think of the context, most kids are moving, they're 18, haven't been alone before, move into a university, and they're having to learn how not only to do school, but manage life. And then we're like, well, I can't pay attention in class. Well, excuse my language, but no shit, because you're worried about how do you pay for food, how do you pay for your rent, how do you manage relationships. Oh, I discovered drinking, even though I'm not supposed to be drinking below 21. Oh, now my friends are in all these, dilemmas with social relationships. It's just a really chaotic event, I think, for a lot of kiddos. And if you have any underlying ADHD or any other underlying mental health concern, it just compounds it. So then instead of teaching kids, hey, this is a normal experience, we're going to teach you how to manage stress. And when you manage stress, a lot of these other things are going to go down. We say like, oh, you must have ADHD, let's throw something at you, rather than teaching them skills. So my personal approach in therapy is if anyone's getting on medication, I'm a big believer they should also be in therapy. Because what we see in most all mental health concerns is that if therapy's on, you get effects. If medication's on, you can get effects, but they're not usually better than therapy. And conjointly together, they're the strongest effect. So in my mind, it's like we should stop pathologizing folks and more teach them that these are normal conditions that humans experience just as part of being human. And there are skills we can learn to help them promote their own well-being and work collaboratively together. It just takes a lot of time and resources, and that doesn't really fit well for a capitalistic model, right?